Hello, and I'm Dr. Chad Lavender with Marshall University, Marshall Health, and I have Ryan Dorsey here with me today. So Ryan's here for a unique procedure that we were one of the first to offer in the country, which is the nanoneedle arthroscopy. Ryan, first tell us a little bit about yourself and how you injured your knee and what you do and all that.
Well, my name is Ryan Dorsey, and Chad and I have grown up since about this tall. So we've known each other for 30 some years, and I just recently moved back home with my son, and my son thought it would be a good idea to push me from behind into a swimming pool with all my clothes on. And in a split second, I tried to overcompensate to keep the top half of my body dry, and I hyperextended my knee and tore my meniscus.
All right, so he has a torn meniscus, as you heard. The unique thing about the nanoneedle is a smaller arthroscopy device that allows us to visualize the meniscus tear really without making standard portals through the size of something the size of a spinal needle. And what that allows us to do is create less tissue damage and pump less fluid into the joint. What we found is that improves patients' earlier outcomes. Their patient-reported outcomes basically become normal by the 4-week or sometimes 2-week mark. So it leads to a better earlier outcome for patients that are really active, such as Ryan. The nanoneedle is really exciting. It's something we offer here at Marshall. And like I said, we were one of the first places in the country to use it, and also the first to publish its use in the knee. So this is the nanoneedle, and this is what we're talking about, what we're going to use today. And this is actually going to be the scope, and you can see how small the diameter is on the needle. So it truly allows us to visualize through something the size of a needle. So we'll cannulate through a needle and then place our nanoneedle into the knee joint. For comparison purposes, here's a standard scope, and you can put those next to each other and see the diameter difference and how much larger, really twice as big. The standard scope sheath is about twice as large. So for nanoarthroscopy, and again, all of this is released from a company called Arthrex, and they've done a great job with a full complement of nanotechnology tools and devices. So this is an example of a nano shaver. And this will be used to debride the joint, in this case to help debride the meniscus. And again, you see the small diameter compared to 4.5, 5 millimeter or larger shavers that we typically would use. And so really it's a full complement of instrumentation, not just the scope, but also instrumentation such as this. So you can see the final product there. We've debrided the meniscus that was torn. There's no flap, and that's what was creating his symptoms. So he should do well. This is the knee after the procedure, and there's a great outline of the kneecap. We haven't filled the knee full of 1,500 or 1,200 cc's of fluid. Hardly any swelling, and you can see just small little needle sticks there that we did the procedure through. So that's why they tend to do well and go back to activity sooner.
Hey there, I'm Dr. Lavender with Marshall Orthopaedics, and we've got Ryan Dorsey here with me again. Now he is 48 hours or so, give or take, from his nano arthroscopy of his knee, where we treated his meniscus as well as some arthritis that he had. And you know, the reason we talked about actually before and during surgery about the NanoScope being so small, the size of a needle, The reason that's important is because it leads to improved earlier outcomes in our research.
Yeah, so within 24 hours I was able to bend my knee like so, and I was really impressed by my range of motion with, just the day after. And then now here we are 48 hours and I'm able to go all the way down, squat, I'm walking without a crutch. So I'm really impressed with how I'm feeling, and it's pretty remarkable.
All right, so let's look at Ryan's knee. Things I want to point out, his quad's already coming back. Raise your leg off the table. Great. And you can see his outline of his patella, his kneecap, which that shows us there's hardly any swelling within the knee joint, and that's why he's able to really move his knee. So bend your knee for me. So he has really great range of motion 2 days out from surgery. So when we talk about athletes, we're not just talking about NFL player or college football player, but Ryan's a very active actor. He likes to play sports recreationally, and so he's going to have an opportunity to do that really within 2 to 3 weeks after this surgery. And that's what we see with our NanoScope patients. Something that we've really, like I mentioned the other day, we were one of the first sites to use this. We have the first randomized clinical trial on the NanoScope in the knee here now that we're doing, and really excited about Ryan's progress, and it matches so well with what we have seen over the last 2 to 3 years. All right, so we're back with Ryan Dorsey here, and really excited about his progress. So you've been able to see Ryan from the pre-op process to the operative experience all the way through. Now we're 2 weeks out. And at just 2 weeks, we're showing you some footage of him actually jogging down our hallway here. He's already been back in the gym. Tell us about your experience, Ryan, and what you expect, kind of moving forward.
Compared to what people have told me from friends that have had meniscus repair, and then I tell them my experience, they're kind of blown away by the fact that they're like, you don't have a cast, you don't have a brace. I'm like, this is it. It's a couple stitches. Minimal scarring, it looks like. So yeah, it's been a pretty great experience for my first surgery.
So this is why we're doing research on this nano needle, is because in a case like Ryan, where we're just going in and cleaning out the meniscus, doing a debridement of the knee, how active can patients and people be early post-operatively? You can see his quads already came back. He's able to, he has full range of motion. He has no swelling inside of the knee joint. So Ryan's going back to LA tomorrow, 2 weeks out, to start back his job as an actor. We really hope you've enjoyed this video, showing you all the things pre-operatively, then to the operation itself, and then how fast he's returned and regained his activity to his knee.